Hi, this is Dr. Burns, and I will be talking in this video specifically about things to consider in your writing for reports, as well as notes when you're writing intake information, as well as session notes. Really anything that you document as a counselor, you have to expect might one day published somewhere or be open evidence in court. And so there are certain ways that you want to present things. So a lot of these we'll be talking about, and specifically I have pulled up from one of the syllabi some items that we'll be talking about. We'll be talking about items 1 through 10 in this video. We won't be talking about item 2, so we'll be talking about 9 different items. Item 2 I'll be talking about in the classes that are specifically about reports. So one of the things, number 1, that you would want to consider in general is avoiding the use of quotes. You are, when you're documenting, and especially when you're writing reports, you're there writing a general overview and summary of what is going on. It's not a courtroom transcript, and honestly, unless the client is reporting the exact way that they are going to kill themselves or the exact way that they're going to kill someone else, honestly, quotes just aren't useful and necessary. So avoid the use of quotes. Number 3, especially in reports, you aren't going to use the terms client or patient or first or nicknames, especially in a report. You may relax that a bit in session notes, session by session notes, but especially in the report, any report that's written is a very formal document, and so we don't talk in those terms. What you will do is, for your client, you will either use Ms. and their last name or Mr. and their last name. You'll also use their preferred identifiers such as he, she, her, him, but we need to avoid the use of client or patient in that. So we're again writing formal documentation, and especially in reports, we in reports we're integrating objective information, and so in that moment we are reporting that very formally, so we want to handle the way that we address the client very formally. Number 4, do not mention other people that interact with the client unless that person is integral to the client's concerns. If you must mention another person, you will never use any part of their first or last name. You will use a description such as client's father, client supervisor, and that goes for reports and when you're writing up notes. So an example of what you would not want to be doing in reports is saying something like, Mr. Jones lives with his 2-year-old son Hank and his wife of 5 years, Fran. You would just talk about Mr. Jones lives with his 2-year-old son and his wife of 5 years, and in that. when you're documenting in reports, you need to protect other people's anonymity. And when you're writing a report, you're not writing a report on the other people. Everything in there is contained to them. So, if you need to talk about the client's sister, the client's brother, or if there are client's friend, you need to use those descriptions and just not first, last nicknames at all. Number 5, no use of slang words, jargon, or informal writing of any kind. This is imperative both to writing reports but also to writing up treatment notes and other forms of documentation. So please keep in mind that while you may talk a certain way, or you may text a certain way, you may email a certain way, those ways of communicating are not appropriate in a report or in your treatment notes. This is a formal process of documentation. So an example of number 5 is saying Army vet and not spelling out Army veteran. It can also be in the way that things are expressed. So just because the client expresses things a certain way and may use slang, that is not how you would write it up in your treatment notes or in a report. So an example of this happening, a couple of them, was in a report. A student wrote, "This is where his hatred of screwing up originated." There's other ways to say that, such as this is where his dislike of making mistakes originated. Obviously, there's a lot of other ways to say that, but again, you might say that in email, you might say that in conversation, you might send it in a text, but that's not what should be used inside of a report or inside of client notes. Another example of slang, jargon, informal writing is he is presenting products to sell and push his company's products. To say to sell, and the push part is where you're coming into the jargon, the slang, the informal writing. So he is presenting products to sell his company's products. That's fine. Just understand that, again, this is not an informal writing exercise. Another way that this can come up with number 5, more in terms of informal writing, is you won't do this either in the notes that you write after a session or in a report. You're not going to talk about this as if it's a blow-by-blow that is accounting, or that is actually currently occurring. So I'm going to give you an example of what that might read like. Mr. Jones then mentions some relationship problems occurring between his wife and himself. He states that his wife and himself are happily married. Next, Mr. Jones discusses how essential travel is to his current job. Then Mr. Jones mentions more arguments. So, we aren't in these processes documenting the blow-by-blow events of how things come up within a session. We are only reporting upon events that affect the direct reason for coming in for treatment, and we aren't going to be explaining, like I said, the blow by blow of what's going to be happening. Another thing, point 6, that is very, very important, and this is a hard one for students to avoid in their writing, but it's very important, is 6, no use of the counselor's hypotheses, speculation, personal feelings, or judgment. And that can come up in quite a few ways. And this would either be in reports or in the client's treatment notes. These may be things that you think, but they won't be documented in that particular way. For example, and all of these examples I'm using actually came from the same case, and I understand that you don't know all the aspects of this case, but I'll read a statement, then I'll explain where we're going wrong here. So the statement: he also reported that his sister lives nearby and his son loves seeing his father, suggesting he may see his father often. It is true that in the client's intake that the client did say his sister lives nearby, and he did say that his son loves seeing his father. However, adding in this speculation that it suggests that he may see his father often is not at all appropriate. It's not really happening. It's your speculation doesn't show up in client report writing or in reporting treatment sessions. Another thing, another way this can show up is, and again, this could show up in a report or in treatment notes, but I'm going to specifically talk about this was written on a report under the prompt issues with the client's self-care strategies. So the first sentence that is stated is, it seems as though Mr. Jones's self-care strategies are not all that involved. That is a glaring hypothesis, a glaring judgment, a glaring speculation on the counselor's part. There's no reason at all for anything like that to be said. When you must document things in reference to a client, you are to document what is going on, not the idea, judging them that somehow they're overly simplistic. There's no part of that sentence that should show up anywhere. The second sentence says, in fact, aside from counseling, he does not mention any other form of self-care. Actually, the client does state that there are some other forms of self-care that are used, so those are ignored. Then the next statement says this is an issue in and of itself because he is caring for others and his reputation above caring for himself. And again, that may be the counselor's hypothesis, speculation, personal feeling, or judgment, but that doesn't document objectively what is really going on, and that is your job. So you wouldn't be documenting that information. There's no part of that that would be there. The next sentence states, he also avoids airplanes and elevators as much as possible, but simply avoiding the problem will not heal it, period. Now, actually, the beginning part of that sentence, that is an issue with the client's self-care strategies, because he does avoid airplanes and elevators as much as possible. And that can, according to him in this case, that is causing him significant issues at work. It's the add-on statement, but simply avoiding the problem will not heal it. That's, again, complete hypothesis, speculation, personal feelings, or judgment, and that's not, you're never, ever, ever being asked to provide that. So it's fine to state what is in fact going on, but your conceptualization of it, not okay. Another example where this showed up was there was a statement that said, Mr. Jones did not report whether or not he was able to discuss personal matters with his family of origin. This should be noted when considering cultural aspects and interpretations of assessments. None of that should actually be there. If Mr. Jones did not report whether or not he was able to discuss personal matters with his family of origin, that's the counselor projecting what should have been on the client's mind. It wasn't there. So, again, this comes down to speculation, a judgment, and that's neither here nor there. It shouldn't be written in a session note. It shouldn't be written in a report. There's no need to write about things that don't exist and then to speculate further about them. Another way that judgment can show up is in describing other people. And in this particular case, there is a husband and a wife, and once they have a child, the wife moves down to part-time employment, and she has concerns, and it's documented by the husband that they are having arguments over how his symptoms, which are causing great problems at work, are impacting the family. And then there's also a concern because the client was involved in an airplane crash and survived it, that the wife really feels uneasy because his job requires him to be on planes quite often. So the client does talk about the idea that there are stressful concerns going on between the two of them. And it was, no matter how your client describes another person or what they say about them, you need to take that seriously in the case of their treatment, because that is their perception, that is what they are experiencing, and that has value. However, just because the client reports that something is a problem, it's hard to completely understand, because you don't get to hear both sides of the story, how objective those statements are. And so if another person must be discussed in a report or even in treatment notes, you must discuss those other people not with judgment, but with discussing the fact that there are concerns between the two. And it was quite troubling as I read student report write-ups on this case, how often the wife was referred to in incredibly derogatory manner. And while the client did report obviously having concerns and the fact that the two are getting into arguments, the client didn't even use this type of language, but it wouldn't have mattered if the client had. The sentence I'm about to say shouldn't be used. It does not matter. So here's the sentence that was written. Mr. Jones reports his wife nagging him about staying home more or finding a different job. That really makes the wife, it completely dismisses the wife. And it's fine to say Mr. Jones reports he and his wife getting into arguments because she would like him to be home more and to find a different job where he can be home more, or something like that. It's not about the fact that they aren't having conflict. She should never be described as nagging him. And even if he said she was nagging him, that's not how you can't go about presenting it in those terms. It's not you're there to present objective facts if you must present those facts at all. So we need to keep that in mind. Another way that item 6 has shown up was in one report. It was written, it could be gleaned that Mr. Jones copes by spending time with his son when he can, and also by throwing himself into his work. He has reiterated that by coming into sessions wearing his company identification. The idea that the sentence begins with, it could be gleaned, says that what's coming is speculation, it's judgment, and so that should just not be there. The client is either reporting that it helps him to cope by spending time with his son or not. The second part of that first sentence was, and also by throwing himself into his work. Writing it in that way is not helpful because, again, it's a speculation. However, if in the intake interview itself that he does cope by, let's say, putting in extra practice or putting in extra effort, then we just document that. So when we say, and also just saying things like by throwing himself into his work, well, what exactly does that mean? And then the last bit, that he would reiterate that by coming into sessions wearing his company identification. Boy, that's a huge leap to assume that he came to sessions wearing his company identification, because that means he's throwing himself into his work. If you have to wear a badge all day long, you could just simply leave it on until you get home and put it in a specific spot. So I'm just trying to say that there's, that's a huge leap, and there's no data to actually support that. Another way where number 6 has shown up in a report, and again, this could also show up inappropriately in session notes, is in the report, the prompt is asking about the client's current coping strategy, Um, and and so what is written is Mr. Jones sees he is not feeling like himself and not performing at his best at work as well as home. He wants to feel better in being able to do his job and learn skills to help with his claustrophobia and anxiety. That's the counselor's understanding, the counselor's judgment of what's going on, but that has nothing to do with the client's current coping strategies. That's how the counselor perceives him. Furthermore, the next sentence reads, Mr. Jones coming to counseling to get support shows how brave he is. Again, this is the counselor's personal judgment, and it's not that we aren't supportive of our clients, but again, this is a leap. So the prompt is the client's current coping strategies, and it was appropriate to include in those coping strategies that Mr. Jones is now coming to counseling. That's fine. But the part that says it shows how brave he is, now you're making a type of judgment, and that's not what's being asked of you. You can think that's fine, but that's not what you are there to report, either in a session note or in an actual formal report. This isn't about your judgment. This isn't about how you feel about it or how you perceive it. And again, we're not trying to make the client look bad, but we need to leave those kind of personal issues out. Another way that this showed up was in the scenario. It talked about a point where this client is a pharmaceutical sales representative, so obviously part of the job is to go to physicians and have interactive sessions to talk to them about the medication and how to use it and what the contraindications are and all those good things. So I mean, the job is about training physicians on the appropriate use of the job. And one of the things that kind of makes the symptoms much worse, it's not that the symptoms don't exist before this, but it makes it much worse, is there was an incident with a doctor where there was a group of physicians in a hospital listening to this client talk about a specific drug. And so in the report, this first sentence is highly appropriate. He was giving a presentation on a drug and was criticized because he did not know the answers to multiple questions. That is perfectly fine. Great way to report it. It's the next sentence that that becomes problematic. All the questions were coming from the same doctor who should have never asked the questions in the first place because they were medical. Well, if you're a sales rep for a pharmaceutical company and you are trying to help physicians understand how to appropriately use their product, they are going to have to ask medical questions. That's the only topic on the table. So the one thing is to write it this way. All the conversation has to be medical. When the client's describing this, he's talking about the idea that this one doctor in particular started down a series of overly technical questions that the the sales rep did not have the direct answers to, and kept saying that, the information could be found out and given. Well, the physician in question continued to do this and continued to do this, and it was obviously very uncomfortable and put him on the spot with a lot of people. So obviously it was a problem, and all of that, but it's not the first part of the sentence that all the questions were coming from the same doctor. That's fine. But it's the judgment that who should have never asked the questions in the first place because they were medical. Doctors have a right to understand a considerable depth in terms of how a medication functions. So yes, in this scenario, this particular physician was quite inappropriate, but the counselor doesn't. The way this is stated by the counselor is just highly personal feelings, judgments, and we don't need to go there. Another example of where the counselor's judgment comes up, and it's kind of similar to one we've seen before. In a report it was written, "It is a big step for him to be seeking counseling now after having some fears and anxieties over the majority of his adult life." It's fine to be talking about after having fears and anxieties the majority of his adult life, that he's seeking counseling as a self-care strategy. It's fine to report that. The idea that it is a big step for him, that's kind of informal, but it also is an interjection of the counselor's views on this matter, which is not appropriate. You're there to report as objectively as you humanly can. Another way that 6 shows up in the counselor's hypotheses, speculation, personal feelings, or judgment is in when information is added or subtracted that actually never exist in what the client talks about. So for the same client, in one of the reports it states he is the sole financial provider, and that's not true. His wife also works. She may be down to part-time, but he's not the sole financial provider. Another item that didn't exist but showed up in a report is he also dislikes criticism in all aspects, especially in public speaking. As you got to hear all the concerns about the intake, he has concerns about public speaking, but he doesn't have concerns with criticism. The criticism isn't the issue. The issue is the anxiety and fear of public speaking. But it's so we need to focus on what the client's actually reporting and saying, and not extrapolating that in ways that are, that we're distorting what they're really reporting. Another thing that showed up that just never existed, there was a statement, "Mr. Jones does not want his father to perceive his son as a failure, and thus does not speak with him about the problems he is currently experiencing." Well, in this scenario, there was never a time when the client talked about his father to perceiving his son as a failure or a concern about that. So the whole beginning part of that, about that, don't exist. Um, but also, um, the client doesn't talk about it being a concern that he is talking about, or that he can't talk about the problems with his father. There's no comment on this matter, so the only reason for bringing it up is because somehow the counselor has some personal feeling or is making their own judgment or hypotheses, but it didn't match, what's written just doesn't match the case. 6 can show up in ways where suddenly they have a sibling that didn't exist, or there was another statement, thus leaving Mr. Jones without his father's assistance when it seems that he needed it the most. And even the last bit, when it seems, is just directing you to this is all speculation. But Mr. Jones never actually talks about the fact that he wants to talk to his father about this. So again, adding in things and concerns that actually the client doesn't have is also problematic. So you can see there's a lot of ways that number 6 can show up, and so you need to consider keeping that in check. Point number 7 says you can't use words like good or bad or any other words that suggest moral judgments, as well as using absolutes like always or never. When you're writing up reports, or when you're writing up, let's say, the intake interview notes, you'll need to talk about certain aspects. So one of them is the client's medical diagnoses and illnesses. So in one report it was written, Mr. Jones has no medical diagnoses and illnesses. You can't say it like that because you don't know. You would say something to the effect of Mr. Jones did not disclose medical diagnoses and illnesses, or Mr. Jones did not report medical illnesses and diagnoses. You haven't been told about it. It is actually a problem, liability-wise, for you to state something like that, absolutely, when all you know is what you're told. And so you want to change that. Additionally, this can show up if you're discussing the client's overall suicide risk. What's written is Mr. Jones exhibits no suicidal ideation and poses no suicidal risk. You don't want to write it like that. It would be Mr. Jones did not report suicidal ideation and suicidal risk, or something like that. Let's say you're talking about client sexual, emotional, and physical abuse history. What's written here is Mr. Jones does not have a history of sexual, emotional, or physical abuse. Again, they may not have disclosed it to you, so you would want to write Mr. Jones did not report having a history of sexual, emotional, or physical abuse. The other way where you need to watch about the use of absolutes is by beginning to say that if one thing happens, that absolutely something else will occur. So I'm going to read a statement, and then I'll talk to you about how this sort of absolutes is an issue. So the statement is, Mr. Jones's wife is putting pressure on him, which will make him lose his job and fail to support his family. I actually don't have any problem with Mr. Jones's wife is putting on pressure. is putting pressure on him. The problem comes with which will make him lose his job and fail to support his family. You do not, I mean, this individual is basically saying they know what's going to happen absolutely in the future, and that's not appropriate, and you don't know that. And actually, if you're looking at the client's intake, it would be appropriate to say, Mr. Jones's wife is putting pressure on him, which makes him fear losing his job and failing to support his family. You know, he does talk about these concerns. It's not okay to suddenly change it into, because she's putting pressure on him, that this is going to be the outcome. That it's just not right, and it's just not appropriate to be doing that. We'll move down to number 8. No use of any information, events, experiences, or descriptions not directly tied to the patient's functional status and counseling treatment plan. Only data relevant to the referral questions will be included. Certain types of data should never be included. Incriminating or embarrassing data should either be omitted or, if absolutely necessary, as a fundamental aspect for the reason for the referral, should be rephrased. Every attempt should be made to demonstrate respect for the client. Avoid invading the person's privacy more than is necessary and or embarrassing the person. So I'll talk about a couple of ways that this showed up in this particular scenario. So often in reports, or if you're reporting things from the initial intake with a client, you're asked to describe the client's family of origin. And it's fine. The sentence that comes before this is perfectly fine. Mr. Jones has an older sister who is married with 2 children. Great. We haven't used names, which is fabulous. It helps to give a little bit of a context of his family situation. The next line that comes says, he explained that his brother-in-law is a successful entrepreneur, so his sister only completed high school and has no need for a college degree. There is absolutely zero reason why this would ever be documented anywhere. This is a huge invasion of the privacy of his sister and her husband. It's extraordinarily judgmental of the sister, but that's gossip. It's just flat out gossip. It has no interest in being here. Or no reason to be there. The reason he's coming to counseling has nothing to do with this piece of information, and it's irrelevant to the case. So you really need to think, is that necessary to put in there? And again, it's a breach of confidentiality of people who aren't even involved in the work that you're doing. So so that's going to be a problem. The the other way that this shows up is when other people are talked about, or things are talked about in a way that's a little too intimate. So this particular scenario, the client's coming in because they're afraid that they're going to lose their job because of their fear of being on planes and being in elevators, and that's often required of them, and it's getting in the way of functioning at work. And so he's feeling very stressed, rightfully so, about how does he manage all this, and an extreme fear right now of public speaking when that's his job. He goes in and speaks to groups of doctors at a time. So obviously there's a lot going on there. In the course of the intake, the client discloses that he and his wife are having arguments over, she'd like him just to leave the job, do something else, and and especially since there was a plane crash, he survived, that's making her really leery, and they have a child, so that's also a legitimate concern for her to have as well. But in the course of this, he talks about how over time, as this has all escalated, what's been occurring in their sex life. And again, number 8, no use of any information, events, experiences, or descriptions not directly tied to the patient's functional status and counseling treatment plan. The client's not coming in for sex therapy. You can easily document where the real conflict is between the husband and wife, and therefore nowhere, and not even in session notes after a session, there's no reason to document the concerns with sex. You're never going to be talking to anybody about any kind of treatment regarding sex. So in many reports, it was written things like, he also commented that this has put pressure on their sex life, stating that they only have sex once a month and that when they do, it feels forced. There's just absolutely no reason for this to be written down anywhere at any time. It's not that you as the counselor, when you're providing treatment, aren't aware of this and you're hoping that as treatment progresses that would improve, but that's not the main concern, and therefore by writing that down, you're invading their privacy, is also the wife's privacy. And I'll just reiterate that obviously with reports, you're sending those out to other people, so obviously it should never ever be showing up there, unless of course like maybe they're you're doing the report because they're a sex offender. Okay, now we have to go there. But in the weekly client session notes, it shouldn't be talked about in there either, because if those get opened up inside of court, there is no reason for anybody to have access to that. So, this isn't, when you're writing things about the client, this isn't a diary. You're not marking every blow by blow. That's not what's going on here. Another way, no use of any information, events, experiences, or descriptions not directly tied to the patient's functional status. So we've talked about the idea that in this case, that there is conflict between the husband and wife about just the fact that he's traveling a lot, which takes him away from the family. The concern she has over the fact that he's already survived one plane crash. And so this first statement I'm going to read is appropriate. Mr. Jones senses that his wife wants him to decrease his hours at work. Great. That's wonderful. What's going to come next is information about the wife that really comes down to just being gossip. It's making speculation about the wife, her motivations, and all of those things. But this is about the wife, her functioning, and the wife should only be talked about in the report or in a session note in ways of how maybe what she does or what she says impacts him, but this should not be a description of her. So this next sentence, this first sentence just should not be here because it's all about his wife. Sentence. His wife never wanted to decrease her hours at her job at a nonprofit agency. you can discuss it in terms of if he says that some of the argument was about the fact that she decreased her hours, that's fine. But there's no reason to write a complete sentence about this aspect of the wife. Also, however, they felt she had to because the cost of childcare was too expensive and she was better off taking care of their son. Once again, that's too much personal information. That has nothing to do with anything. That's gossip. It is not directly tied to the patient's functional status. Even in a client note for a session, there's no reason to report that. Again, this is not a diary of what's going on with the person. Then the next sentence says, it is possible that Mr. Jones's wife resents him because he is still able to work full-time while she no longer has that option. And wow, okay, so now we're making speculations about the wife's motivations. She's not the subject of this. This should not be in here. I mean, this does also fall under the category of not judging other people and your personal hypotheses and speculations or judgments. That is neither here nor there. So it should not even be, that stuff should not be discussed. Number 9, consider how the patient is represented by looking for biases in your writing that may represent the client. Be culturally sensitive to the language that you use. Anything that you write in a report is going to hold weight. And so you're only going to write things in a report, or, I should also take it back, also in the treatment notes, the weekly treatment notes, that are of importance. And if you start talking about things that aren't important, then you make it seem like they are important when they're not, which again comes down to misrepresenting the client, number 9. So, for example, inside of this intake, it was noted that twice, when answering certain things, the client initially responds with a bit of a joke and then answers answers the question seriously. So it's twice in a whole intake interview. And there was more than one individual who wrote things like, Mr. Jones made jokes and laughed quite a bit during the intake interview. No. No, it didn't happen quite a bit. It happened twice. And often people, when they're nervous, will use that tactic. So it's one thing to say that if literally throughout the entire intake interview they're just making wisecracks the whole time and not taking it seriously. But by writing that, A, it doesn't represent what actually really went on, but B, it shouldn't be mentioned at all, because now you're starting to get the reader to get the wrong impression of the client. Another example, for this particular client, he reported drinking alcohol 5 times in the past 30 days and drinking alcohol to intoxication 0 times in the past 30 days. And so, that was, collecting that information was just part of the interviewing process with this particular client. So in one report, under the client's drug and alcohol addiction section, it is stated he reported drinking alcohol 5 times in the past 30 days and drinking alcohol to intoxication 0 times in the past 30 days. And that should not be stated there. It literally, the prompt is client's drug and alcohol addictions. What should be written there is Mr. Jones reported no drug or alcohol addiction. So by saying it, by even talking about, okay, he happened to say he had 5 drinks in 30 days, now you're making something look like something when it isn't anything. He doesn't report any alcohol or drug addiction, so you want to leave it alone at that. This same thing came up where somebody else wrote it in a report under the prompt, issues with the client's self-care strategies. The statement literally says he reported, well, and I'm just going to read what's written here. He reported he has drank alcohol within the past 30 days and for 15 years during his lifetime. Mr. Jones reported he had not drank to intoxication within the last 30 days. That is not an issue with the client's self-care strategies. There's no issue there. Drinking alcohol 5 times in 30 days, it's not a self-care strategy. So you need to be talking about the things that actually have meaning, and if something doesn't have any meaning, then you need to not talk about it, because you're making it a concern when the concern doesn't exist, and then that misrepresents the client. Point 10 is counselors should never write anything in a report that cannot be justified or validated by appropriate evidence-based methods of counseling, assessment, and treatment, counselor scope of practice, and other acceptable forms of clinical evidence. So this last statement that I'm going to read that was written in a report, it shouldn't show up in a report. It also shouldn't show up in individual treatment notes. But you know, this also can fall under the idea of the counselor's hypotheses, speculation, personal feelings, or judgments. But, you know, I applaud the individual who wrote this, because what it demonstrates is that they're really trying to think about integrating all the various things that they learned in working with this client, and I appreciate that. But what is being turned in is a report that you were supposedly giving out to other people, and even if we're talking about individual treatment session, what's going to be described is not in your scope of practice. You're not an expert in this, and there's absolutely no reason for it to be documented. That, however, doesn't mean that that it isn't wise to think about this, and so it is wise to conceptualize this as the counselor working with them. So I applaud the student for this. The challenge becomes is that we don't write any of this down. That this is the stuff that we're using to do good counseling work with our clients, but we're not going to document that. And so here's the statement. Lastly, through the study of epigenetics, the trauma that both of his parents incurred during their immigration process, and also the trauma that Mr. Jones's father experienced in the war, could also be contributing to Mr. Jones's anxiety and depression. So, again, that's an excellent thought, and there's validity to that. The problem is that we don't have the scope of practice as counselors to validate proof of that. So it's important to keep that in mind. I'm not negating that at all. And again, this kind of falls back under the counselor's hypotheses and things like that. It's not a bad one to hold. We just aren't going to document that because we can't really prove it. So I do hope that kind of going over this and giving you some examples might be helpful as you are moving forward and writing up either treatment plans or case conceptualizations or assessment reports, session notes, things like that. Good things to keep in mind. So thanks for listening and have a great rest of your day.